I'm very happy to be here. I was telling my kids and my husband this morning that um, this population, you all are my favorite. I love this. Because I worked in a hospital for so long and I do a lot of consultation. I love speaking to medical providers and hospital clinic settings. So it's really great to be here. So I'm going to share my screen and then get started. So let's start with thinking back to your most recent clinic day. You're running behind, your inbox is full, your patient is sitting there with their arms crossed, they're a teenager, and the parent is giving you that look that kind of says, okay, please fix this right now. I don't even want to be here. And then you ask a simple question to the teen patient. How are things going at home? And the teen shrugs and they're like, fine. You ask about school. I don't know. You ask about sleep, whatever. 6, 7. And meanwhile, the parent jumps in, they're rapid fire. Well, they're not listening to me. They're not sleeping at night. I'm concerned about their homework. They're disrespectful. They shut down. Won't do anything I tell them to do. I'm always on them. I think they may have ADHD. Their father is getting on my last nerve. It's like they don't even care. And in that moment, it's easy for everybody in the room to get tense, to get pulled into the same storyline. This teen is resistant. I now have a resistant, defiant teen. But here's the reframe. Sometimes what looks like resistance is protection, overwhelm, burnout, pain, shame, loneliness. It is normal, expected feelings coming out sideways, and then distorted on the way out. And I see this every time. This is exactly why I wrote about this in my book about loving the teen in front of you, accepting the teen in front of you, because those messages can get distorted from their brain through their mouth. And the other thing is why I care so deeply about this work is because I understand what it's like to sit on the other side of the room. I've worked in primary care clinics. I've worked in a military medical hospital. I've worked in private practice now for 10 years, worked in multiple different interdisciplinary teams. And what I have seen over and over again is when we see someone who is resistant, there is more to the story than that. And I think we can get so caught up in labeling it as, oh, this parent is annoying or this teen is difficult. And why I have a lot of success working with these individuals is because I see beyond the resistance. I see beyond the story that they think they're trying to tell. It's like watching kind of like one of my favorite type of movies is like a thriller or a psychological thriller where you think one thing is happening, but it's a completely different narrative going on. And when teens resist, it's rarely about being difficult for the sake of just being difficult. It's usually about autonomy and overwhelm and nervous system protection. And the way we respond to the resistance can either intensify the power struggle or lower the heat and keep the relationship intact. So really, it's about paying attention to more than just the resistance. So I'm not going to give you a bunch of fluffy advice. I'm not about that life or tell you what you already know. You're smart, you're intelligent, you probably got a bunch of degrees. And so you know a lot of stuff already, but yet it still feels like you get stuck. And it also might help you in your own home too, because you might be raising preteens and teens yourself and feel like, oh, I do great with my teen patients, but at home I feel like a failure. So really, either way, it can help you professionally and personally. And I'm here to give you very practical language that you can model in brief visits, because I know you don't have a lot of time. When I do therapy appointments with my teen patients, I've got teen clients, I've got like 45 minutes to an hour. You have 15, maybe 20 minutes, maybe 30 minutes on a good day. So the more that we normalize this, then the easier it can be. And one of the biggest myths I see with parenting and providers is that they think that I just have to fix my teen and then things will be okay. I have to fix this teen patient and then things will be okay. And that's just not true. It's more to it than that. Adolescent development takes time, and emotional regulation takes time. Executive functioning takes time. Autonomy, it's not just a switch that you flip, it is a process. And so we're going to talk about what's normal, what's meaningful, what is modifiable, and how you can coach parents to stop getting pulled into power struggles and start becoming the steady person their teen actually needs. So that's why we're going to crack this code today and help you find out what to do next and make it really practical. Okay. All right. So these may sound familiar, low key chopped. It's really funny. I'm from the Virgin Islands, born and raised in St. Croix. And when I saw a video of someone talking about terms that they're using as young adults, teenagers, and the terms are exactly the same as when I was a teenager. Like very few slangs have changed in like 30, 40 years. And for this generation, specifically Gen Alpha, the ones who are younger, 13 or younger, their dialect seems to change every other week, like literally. So we're going to look at all of these low-key chopped lit, all these different terms and how we can make the interactions between the parent and the teen better. So let's start with what that looks like. These are all the people that I've worked with, collaborations I've done. So this is work that I really enjoy doing, and I have lots of different experiences working with a lot of different companies and messages that people want to hear. So let's start with what some of this having a teen in your house might be like.
Having a teen be like, hey, you want to come watch a movie? That sounds absolutely terrible. I would literally rather clean my eyeballs with Q-tips and go hang out with y'all. Can you turn the light back off? Hey mom, so I know that I haven't done like any of my chores and I'm failing a class, but can I please have a sleepover? I will do anything for you. I will do anything. I love you so much. I swear I will do everything in the world for you if you could just do this one thing for me. Hey mom, can you pick me up some Chick-fil-A on your way home? Mom, look at this boy. Isn't he so cute? My friend liked his photo though, and so I kind of have beef with her low key. I don't want to talk to anyone right now.
Okay, that's really weird though, because you're talking to like literally like 20,000 people on Snapchat right now.
I want to talk to my friends. I just don't want to talk to anyone in this house.
All right, so does that sound a little bit familiar? I've got a 13-year-old son and a 15-year-old daughter. And yeah, this sounds very, very familiar. They're actually two different generations. My daughter is a baby Gen Zer as a 15-year-old, and my son is a geriatric Gen Alpha, as I call him. So we will talk about how to reframe teen resistance, how to coach parents to validate emotion and maintain limits, communication strategies that reduce power struggles, and then attachment aligned language that you can model during brief visits. So, with understanding teen resistance, resistance is developmentally normal. It is highly irritating, but is extremely developmentally appropriate and normal. There are almost 43 million youth 10 to 19 in the US. So they're 13% of the population. So they're not going anywhere. They're here to stay. And it's important to understand them because there's a really a big sharp rise in mental health concerns and stress load, especially since the pandemic. And typically, about 1 in 5 teens have a mental health diagnosis. There was a statistic rolling around between 2021 and 2023 that it had doubled with the Gen Zers. But it was more like 1 in 4 were experiencing a mental health diagnosis, but it seems like it's still leveling out. So it's not quite clear. But what we're looking at is most common ones are ADHD, Tourette's, autism, anxiety, depression. Those are the ones that we'll most likely see that happens most often. So let's start with this. Take out your phones, because I know you probably have them next to you anyway. Scan the QR code. And what I want you to tell us in real time is what's the most common concern teen patients bring up? Let's start from there. What do you hear from parents, or what do you hear from your teen patients that they are most concerned about? And you can just type it in. So they hate school, stress, their parents, fitting in, friends, screens, yes, sleep trouble, peer pressure, lots of screen time, drug usage, confusing social dynamics, rejection, social media, work, tech limits. Tech limits are ruining my life. That is a big statement. Okay. Sleep trouble, anxiety. That one's coming up a lot. Okay. Great. This is the stuff that I'm hearing as a mental health provider as well. And this is stuff that I'm dealing with as a parent. people are consistently working through. And it's a lot. I don't remember life being this stressful as a teenager. I feel like it's way more stressful now. And I don't know if it's just because of the perception and because of I'm on the other side of it, but this is the ones in green, and the bigger they are, the more people are responding with that most often. But this is fascinating. This is interesting. And so, do any of these surprise you that you're hearing? And they're not surprising me. I'm trying to see if there's any on here that's surprising me that I'm seeing. And I don't think there's any. And that's why I tell teenagers all the time, like, there is nothing you can tell me that's going to surprise me. I've heard it all. But the thing is that they don't know that. And that's why it's so important during our appointments with teenagers to normalize these experiences. Let them know, you know what? This is common. This social isolation, not liking school, feeling anxious. That's the most common one that's up on here. School stress, fitting in, all of these things are super, super impactful, and they're stressful. And so you might even want to take a picture of this and just say, hey, I was in a presentation. These are the things that people say are consistently coming up. Like, you are not alone. This is not just you. This is something that is going on for lots of teenagers, 10 to 18. So yeah, thank you. This is very powerful to see, and I think it's very helpful. So these are the hot topics that I typically see during visits, and this is what some of the research has talked about: the mental health, depression, anxiety, and eating disorders, ADHD, and behavioral issues. So like getting kicked out of school, getting in trouble, suspension, substance use and misuse, reproductive health, diabetes, and obesity, routine physicals, and then relationship, school, and family challenges. So this is the stuff that we're going to see all the time. But then there are some common provider pitfalls. And these are things that typically what I hear from parents when I'm seeing them in the therapy appointments, as well as what some of the clinical research is talking about, is things that providers fall into. And it's common. You're in a rush, you're not thinking through, and they're like, well, they're a teenager. I'm not thinking much about what's happening. So you're maybe not giving them private time to talk to just you without their parent in the room, focusing only on their physical complaints, the knee hurting, the stomach issues, the headache, underestimating their teen autonomy needs, that they want some independence, they want some autonomy, some agency, talking to parents instead of with the teen, rushing through psychosocial screens, so like asking about depression or anxiety or body image issues, suicidality, and then assuming resistance means non-compliance, that they're not taking their diabetes medication, they're not eating right, they're not exercising, they're not being compliant in some way, rather than finding out what's getting in the way. And by the way, that's a great question to ask. I almost always get great answers when I ask teenagers that question. What is getting in the way of you drinking the water that you need to prevent your headaches? What's getting in the way of you getting out of bed to do your homework, because you know that leads to getting sleepy or then getting less motivated? What's getting in the way? And that is a great way to get to the root of what's leading to the resistance, because it's beyond compliance, non-compliance. So then, which pitfall do you encounter the most? It's another poll that we're going to do. I'm just limited to 4 of them, the ones that I hear most often. So again, scan, like, which pitfall do you encounter the most? Are you not giving teens one-on-one time? Are you focusing only on physical complaints? Are you talking to the parents instead of with the teen? Or are you rushing through psychosocial screens? Okay. Yeah. I figured the rushing through psychosocial screens would pop up high. That's very common because, again, you're limited in your time. You may not feel comfortable asking about some of those things, but we'll talk about that more in terms of what that looks like and how you can get comfortable with it. Because even with psychologists, many times when we hear a teen talking about feeling depressed, feeling suicidal, or they slept with a knife in their room, or they're saying all these things, they wrote a note to me, that it can feel uncomfortable for parents and even for professionals and those of us who deal with it all the time. So Let's talk about that more, or also put in the chat and we can talk about that in more depth about why you're rushing through psychosocial screens. What is it about it that makes you uncomfortable? Or why are you forgetting? Why do you think you forget? Okay, so this is really helpful to see. So let's look at why sometimes it's hard to connect with our teen patients.
You born?
2000.
What year were you born?
2002.
What year were you born?
1990.
So, as someone who was born in the 1900s, as my kids keep telling me, I mean, they're not wrong, but it makes you feel like you were born in the dinosaur era, like you don't know anything. And sometimes, if you are perceived as an unk, as the Gen Alphas call it, meaning you are old as an uncle, then they don't know if they can connect with you. If you are perceived as this old fuddy-duddy person who isn't with it and you're using old slang or trying to use their slang, and that's so cringe, then those are things that they can get really turned off by. And it can feel like you're in a dinosaur Jurassic era. So, what providers often get wrong is not introducing themselves to the team. I take my kids to a lot of different types of appointments throughout their years, and this happens most often, especially if it's a pediatrician or a nurse practitioner or a specialist that we've never met with before, and they just start doing stuff, taking blood pressure, getting weights, measures, and it's like, who are you? What are you doing? What is the purpose of today's visit? And it really hit me. This was in Greece when we had a medical emergency with my son last summer, and he had to be hospitalized. And it was very life-threatening, and they had to act quickly. But the scary and unnerving part is he didn't know what was happening. He didn't know who these people were. So there was like this bum rush of like 5, 6 people taking his blood, taking his urine, doing all these things. And he's just like, what are you guys doing? Who are you? And so just being able to get an introduction. Hi, I'm Nancy. I'm your nurse practitioner today. We're going to take some blood. Do you prefer to look at or look away? Just really brief introduction, even when you're rushed, really makes a big difference. Lack of teen-centered communication. Again, talking to them. How are you going to be interacting with them or their body? That's really important. Disregarding appointment barriers. Maybe they don't like coming to this appointment because it's in the way of practice, or there's a big test that they're missing, or there's an activity that they really want to hang out with their friends after school or before school or during lunch. And our appointments are usually during the school day. And then using medical jargon. This is the big one I see often, even in my own medical appointments where I'm speaking to a doctor and they're just rattling off all the lab work and all these big medical terms. And I'm like, okay, I know a lot about a lot of different stuff, but I do not know what you just said. Could you break it down? So making sure that you're using language that's really understandable to them. And you can use the technical words as well too. I will do that. And then I also say what this means is. So, you have ADHD, and that is an executive function dysregulation issue. All that means is that this last part of your brain in your prefrontal cortex, your frontal lobe, right behind your forehead, is the last part of your brain to grow and develop. And so it's sleepy brain, it's lagging behind a little bit, which is what makes paying attention harder for you. So you can use the terms, but then really break it down for them so that they understand what the heck you're talking about. So this is where the join the resistance method comes in. And this is and you're actually the first people for me to talk about it in a very specific way. I've been using this for a very long time, and I really have solidified what this looks like. And I have found it to be successful every single time I use it. I can really claim that, because when I've used it with my own kids and with the patients I've seen over the years in clinics, in interdisciplinary clinics, in medical appointments, in therapy appointments, it works every single time. And this is how we crack the teen resistance code. Because again, resistance isn't resistance. It's more than that. It's something coming out sideways and getting distorted on the way out. And so this is my signature approach that I use, and I use it for a variety of things. So I'm going to show you all the different ways and what it looks like. And then I'm going to give you several examples in the medical area and psychological area, behavioral health, in terms of how it looks and how it shows up. So these are the core components. You're going to recognize the underlying emotion. So you are validating what is underneath. You're regulating the intensity. So you're matching their energy while lowering the heat. Oh, I know, going to school really sucks. That's the recognizing. Oh, I know it's like you would rather stay home than go to that place. I get it. You're recognizing and validating, and you're matching where they're at without escalating. Because the reason why teens often turn up the volume is because they are not feeling heard. So then they escalate. Oh, well, clearly, dude, you didn't hear me. So let me make it louder. You're reassuring what's normal. Yeah, lots of kids don't want to go to school either when they're feeling overwhelmed. I get it. I was the same way when I was your age. Relieving the pressure. You're reducing their pressure to perform. They don't need to prove to you how miserable they are. Well, I could see your hands are clenched, your jaw, oh, you're turning red. Like I could see that you're feeling very stressed out by this situation or this teacher or this appointment. You make requests, not commands. You invite and you ask for the invitation. Is it okay that we go ahead and take blood from this arm or this arm? Is it okay if we go ahead and we're going to put the blood pressure on? Would you rather on the left finger or the right finger? Would you like to look as we take your weight forward or backward? Like you're just inviting and asking for the invitation. Don't make assumptions. You're releasing control. You're giving permission to show up how they choose. So if they're feeling like their one word answer today, like let them giving permission and being able to say, you know what? I just literally just met you and I'm asking you all these personal questions and you don't have to answer any question. I want you to feel comfortable answering what is comfortable for you. But I want you to know the more that I know, the more that I can help you. And then you receive them as they are, accept them unconditionally. Being able, I get it. Yeah, I know you don't want to be here. You'd rather be at practice. Your mom just dragged you here. I get it. And these are things that will help you join their resistance and break it down. So let me give you some examples. Years ago, when I was working at a military hospital as a civilian, as a pediatric psychologist, and I worked consistently with a pediatric pulmonology clinic. And I had this 15-year-old patient that was referred to me who had a lung transplant, and he was doing great. His body had received it. He was breathing fine according to the pulse ox. Like everything was showing that he was doing great. His body was accepting it. He was adjusting, but he didn't believe he was. And he kept gasping for air. He kept saying, I cannot breathe. And they're like, you're breathing fine. Look at the everything. And they kept trying to convince him that he was actually good. He wasn't believing it. So they asked me to come in and do some breathing retraining. And when I first came in, I said, hi, my name is Dr. Lockhart, and I'm the pediatric psychologist. The pulmonologist asked me to come in and speak to you about your breathing. And he's like, you're a shrink. He's like, I don't need to talk about my feelings. I'm like, oh, I'm not here to talk about your feelings. I'm here to talk about your breathing. We don't need to talk about any feelings. That's not my job here with you. So what I did was I immediately joined that resistance. I'm not here to talk about feelings. I'm here to help with your breathing. That was what's inconvenient for him. That was the issue for him. He didn't want to talk about feelings, and I wasn't there for that, even though I knew that was probably something he should talk about. But I wasn't going to push it, and that's what the doctors and nurses kept trying to push. So for several sessions, we worked on the breathing retraining, belly breathing, hypnosis, focus, attention, all that kind of stuff. He did great. And he could see and accept the fact that the lungs were working as they expected and his body was doing great. And after about the fourth or fifth breathing training session, he's like, hey, doc, I know that I said I didn't want to talk about feelings before, but hey, I'm wondering if we can maybe talk about a little bit now. I was like, well, I guess. That's where the joining the resistance is. You don't make such a big deal out of the thing that they're resisting. Of course, a 15-year-old who was a basketball athlete loved it and felt like that was being taken away from him. Of course, there's going to be some resistance to this. How is my life going to be different? How is my longevity going to be different? How's my quality of life going to be different? And you just lean in. Don't try to convince them of something from your perspective. That's not going to help. The other thing is, I always talk about how weird my role is. Again, hey, we go through the intake. There's going to be a few questions now that I'm going to ask. I acknowledge it. There's going to be a few questions I'm going to ask that feel a little uncomfortable. I ask this of every teenager that I see. And again, I want you to know that you can be as open or as not as you want. And I don't really expect you to even answer any of those questions because I literally just met you 10 minutes ago. But the more that I know, the more that I can help you. That in and of itself always provides the invitation for them to be honest and open up. And so because I've just acknowledged the thing that they're already thinking, like say the thing they're thinking anyway. There's times when I've been in the room with a blood draw and a teenager might be like, oh, what if it hurts? And I was like, well, it's probably going to feel uncomfortable. There's a big pointy object going into your skin. So it's probably going to feel uncomfortable and then it won't. Or what if I scream as they do the procedure? Well, I hope you scream. You know, if that's something that your body needs for you to do, I hope you do, and then you won't need to anymore. So again, you're just joining that issue. You're joining the resistance. You're joining their concern, and you're making it like, yeah, I hope you need to do what you do. I hope you will do what you believe that you need to do, and then you won't need to do it anymore. Um, and the same goes for a teen who's disclosing thoughts of suicidality or morbid thoughts. I had a patient one time who had told me that her parent had said, yeah, she was making all these statements about, oh, I wish I would just die, and I wish I wasn't here, and wish I wasn't alive. And what I was asking her is like, did you think that you wanted to kill yourself and didn't want to be alive, or did you just want the pain of your situation to end? And she's like, that I wanted the pain of the situation to end. And so you're validating, well, yeah, that makes sense. A lot of teenagers experience that. That's what we call morbid ideation. And what it just means is that you want your pain, physical or emotional, to just end. So you're validating, you're matching. Yeah, that makes sense. You could do that with your nonverbals, with your tone, with your eyes, with leaning in. You're normalizing. Lots of teenagers experience that. It's very common actually to want to escape pain because our body seeks pleasure and seeks peace. It doesn't want all of that. That makes total sense to me. And being able to invite them in, like, can I ask you more about that experience for you? What did that look like for you? Did you have a plan? Did you think about ending your life at any other time? And then being able to say, you know, because this is information that normally we would talk about information that may stay confidential between you and your provider, that this is a safety issue and I want to make sure I keep you safe. So we're going to invite a parent in. Would you like me to invite your mom or your dad? Would you like me to invite just one or both of them? Do you want to tell them as when they come into the room, or do you want me to lead the conversation for you? And you just allow them to just show up how they are and allowing them to feel normal, that it's okay. And when you are able to do this consistently, you're going to get a patient who's going to tell you more things because they know that you're not going to freak out and flip out and go to the most invasive procedure or treatment next because you've heard them. So this is highly, highly successful, and it's something that I think is very effective in the medical area as well as behavioral health. However, you might not remember all of that because you got a 15-minute appointment and you have a bunch of patients. So here are some 5 micro interventions for busy clinic days or busy clinics or busy days. And this is something that I think could be extremely helpful and effective. And the first one is the 90-second rapport reset. And that's basically, you know, we do this already, scaling. On a scale of 1 to 10, how annoying is today? And you can make it where you're bringing in light humor and emotion check, and you can get more of that connection. That can be very effective. The other thing is the autonomy cue. So you have a diagnosis that you want to give the patient, and you want to make sure that they get the information that they need. And so you're just asking them, hey, do you want the short version or the deep dive? So that way they really understand. And there's some of them who want to understand their diagnosis. They want to understand the prognosis. So being able to provide that information. Hey, do you want the short version or the deep dive? And I'll do this when I'm giving like a diagnostic. Say, okay, this is your diagnosis. You have this. Do you want the short version or the more in-depth, the deep dive version? The third thing is the parent containment line. You might have a parent who is overly talkative, sharing way too much, interrupting their kiddo, and you can just say, oh, thank you. I'll get your perspective in a minute. Let me start with your teen first. So again, your teen focused communication. That teen is being shown that you value what they have to say, and you want to hear what the parent has to say as well too, but I'm going to get to you in a second. And so it puts parents at ease and it centers the teen. The fourth thing is the validation pivot. And that's where you're saying, if the teen says like, I'm fine or whatever, you can say, got it. And if fine had a second sentence, what would it be? If fine had a twin, what would it be saying? If Fine had a translator, what would it say about what you just said? So just bringing in, validating, and then switching it up a little bit. If Fine was a movie, if Fine was the weather, what would the forecast say? So just using some analogies, some metaphors, some imagery, any of that kind of stuff. And then number 5, the limit setting script. You're basically, I'm not here to tell you what to do. I'm here to help you figure out what works for you. Or I don't expect you to tell me your life story. We just met. The more I know, the more I can help. So you're again setting the limits to give them permission to be able to share or less. So what do parents need more of? They don't need more trauma. That's what they don't need. And that's what it feels like when you are, every time you turn around, you're like, oh my gosh, another issue. Every time you feel like you've worked through something, there is more situations coming up that you have to figure out. And what I hear from a lot of parents is parents nowadays are more educated than any generation ever. We've got, um, we have got summits, we've got podcasts, we've got books, we've got workshops. We have all these different things, webinars, meetings, all these different things, blogs, Facebook groups. There are so many things where we have so much more information than we ever had. So it's not that you need to educate parents more, they just need more of the right stuff. And honestly, they need to do less. So, how to support their teen without losing boundaries. Parents need to know how to do that. It's okay for your teen to be angry with you because you have set up a parent control app on their phone to turn it off or turn it on at a certain time, and what apps they have access to, and which ones are blocked, and how much time they spend in a day, and all of those things. That it's okay to validate those feelings without endorsing unsafe choices. Like it seems like you're on TikTok a lot or on Snapchat a lot, or every time you're on that, you feel worse. So I'm going to set up limits around that. And being able to do that, I think one of the most important things is if you're going to give your teen a phone, you need to have a parent control app on it. There's no negotiation. That they don't get free reign. If they are under, especially under age 16, they need to have some kind of parent control app where you are managing when they get on, when they get off. That's what parents need to hear. They need to be given permission. That is okay if their teenager is upset with them because none of their friends have that. It's also how to model calm communication. And you do that by modeling in the appointment how to do that. Like, okay, oh, we'll get to that in a second. Let me hear from your son first. And being able to say, not how not to escalate the conversation, how to hear them. You can talk to them about joining the resistance, how to validate, how to match their energy. That is calm communication. Joining the resistance model is about calm communication. So the teen feels heard and not escalated. How to prompt teens to ask you questions. Don't just after the end of the school day ask, how was school? Like that is a question teenagers hate often. They want to have it be more interesting. What's the best thing that happened today? Well, you got any tea? Oh, it sounds like you were sharing about what was happening with your friend yesterday, or your teacher did this. What happened was different. Like whatever it is, or sharing about what's going on in the world, in life, in the weather, weekend plans. Like do have them talk about other things that are interesting, mixing it up a little bit. Number 5, how to prep teens to lead their health discussions. So, okay, we're going to the doctor in tomorrow. So before the appointment, let's write down your symptoms. Let's write down the concerns that you have. I'll tell clients, like if you have headaches and stomach aches or concerns that you have throughout the week, use your notes app and write those things down in the moment so that you don't forget. I have lots of teens who come in and say, oh, I had problems last week, but now today I feel like everything's better and I don't know what to talk about. I'm like, okay, well, great. I'm glad things are better. As things are going on throughout your day, throughout your week, write them down so that way you can bring those things up. Encouraging more independence, teaching your kids how to cook a meal, how to do their laundry, how to clean their room, and showing them those things, but also encouraging independent thinking and independent behaviors. And then communicating more clearly, how to speak up, starting with asking them with curiosity. You know, when they need to speak to their teacher, when they need to speak to a friend about a dilemma that's going on. any of those kinds of things. Parents need more of that. So being able to create those worksheets for them, create that conversation piece for them, having things on your website, having things where they can get pamphlets from other organizations that speak on these things. These are the things that parents need more often. And they're more likely to see you before they ever see a behavioral health provider. Because teens can be difficult to understand sometimes.
Hey, Dad. So about like 3 days ago, or 3 days ago, a couple weeks ago, or like 4 months ago, my friend Jeremy, was it Jeremy? Jeremy or was it Kyle? One of those two told me, I think it was Kyle, but Kyle was telling me about this game that's coming out. And when it comes out, it's only going to be like $80, or was it $80? Was it $60? And no, wait, it was like $20. And he told me that when it comes out, like he was going to get it, and he'd let me borrow it for a little bit to see if I liked it. But then also, there's another game that I want to buy, so I'm not sure if I want to do that or not. But I was just letting you know. Okay. Thank you.
So yeah, teens can be hard to understand, and a lot of that is their frontal lobe. It's executive functioning, is learning how to put words and thoughts together to deliver it in a way that another human being would understand. So that could be rough because it is a process. But what parents and providers, we all need to remember is, what are we focusing on? When we're focusing on the resistance, we're focusing on all the many ways that this teenager in front of us is making our job harder and how they're making our life stressful. I totally get it. I'm a parent myself. But what are the things that we're missing out on? All the wonderful things that they are and what they're doing that we don't pay attention to, that we forget, and then we're not telling them. So making sure that you say that during your visits. I love that even though you were missing part of your practice, you still decided to show up here. I love that you are taking your medication just as prescribed, even when it feels hard or inconvenient. Like, that makes a big difference. So being able to say that, and I think that goes a long way. And that way you're modeling that for the parent to hear that as well too, and telling the parent to do that, not just focusing on all the many ways Johnny's annoying her. Because it's important to crack the code, because when we don't, it can feel like we're getting roughed up by the whole situation, because then we're in a battle that we can't win.
This is week 1 of learning ventriloquism.
This is week 2 of learning ventriloquism. This is week 3 of...
Hey, not how I sound.
What was that? This is week 4.
You don't speak unless spoken to. This is week 7, and today I decided we're robbing a pharmacy.
So this is what it can feel like when you're a parent. Like, you're just trying so hard, and it's like they're running the show, and it doesn't have to be that way. We have to dig deeper. We have to get curious and find out what's really, really going on. So what I would say is, these are the areas that are really important, regardless of the struggle, that you can use for yourself. You can talk to the parents about, and these are the ones that are always my go-to. So again, like join the resistance, which I've talked about a ton, changing their parent mindset. It's not just about, getting the referral and changing my kid. How can they change their mindset? And that's what my book, Love the Teen You Have. I talk a lot about that it's less about changing your teenager, and it's more about changing your mind. Being playful, that it's not just about the tasks and all the things that your teen needs to do. It's okay to be playful and be fun. And even being playful in your appointment with the teenagers, using redirection, really focusing on different things. Oh, my knee has been hurting and I can't do this. Well, look at all the other things that you have been able to do. That's really great. So you validate what they're going through, and then redirecting to all the things that they can start to do and when. Distraction can be used as well too. Movement, taking movement breaks, being able to move around when things are getting tense. Those are things. Movement is really helpful, especially for teenagers with ADHD, with anxiety, depression. Also, helping parents know, and for you, not to take their behavior personally. Again, remember, the resistance, the mood, the attitude is often more than just about what you're seeing. There's so much more going on. And that's what teenagers hate, is when the adult in front of them is taking their behavior personally. It's not about you. Stop trying to fix people in your home. important to emphasize that with parents. And if you are going through the same thing, you don't have to fix anybody. Teenagers don't want to feel like they're broken and that you're just sending them off to therapy or sending them off to the specialist because you think there's something wrong with them. No one wants to feel that way. And then also encouraging parents and for yourself, sometimes you have to do less, like stop trying more strategies and focus more on connecting. The strategies won't work if the relationship isn't there. And it's really interesting because in all the different psychological interventions as a psychologist that are out there that are evidence-based and that work for a variety of things, the thing that has been shown through the decades to work more than any strategy, and this goes for medical providers as well, is the relationship. The relationship bypasses and is by far more important than any intervention you can ever do. Because if the patient in front of you doesn't think you like them and you've just given up on them, then nothing you say and do about any medication or treatment or referral is going to make a difference. The relationship is what matters the most. And then also teaching critical thinking and problem solving skills. So if a kid is mature enough to take their own medication and they keep forgetting because they're relying on their parent or they're not waking up because their parent has to wake them up instead of their alarm, teach them how to think through the problem that needs to be solved, how to think through how to solve issues, how to talk to their teacher, whatever it is. This is a really big one. I find a lot of students in this generation don't have this. They're lacking this. This is a big issue. So we want to teach more of that. Because we can't do it all for people. So how easy would it have been to just pick up the shoe and give it, right? But that's not how problem solving and critical thinking and persistence and resilience is built. It's built by being alongside them. And that's what we're doing is we're standing and sitting and stooping alongside the teenager and that parent to help them through what's going on.